Hi everyone, welcome to my channel. My name is Daisy. Welcome to Daisy's Inspiration TV. Thank you so much for always coming back to watch me. And to those of you that have just subscribed to my channel, I just want to say a very big thank you. But I'm a little bit sad. Why? Because you all watch me, you like, you subscribe, but you do not drop a comment. So how do I get to thank you personally for being so kind to me? So please, if you're subscribing to my channel, kindly drop me a comment so that I am able to officially appreciate you for being a part of my family. So without wasting much time, I would like to say this very quickly before going into the topic for today. We are talking health related issue today, but before we start, I'm gonna say something. There are two main set of people that I would like to affect. Yes, that I would like to affect with my details today. Definitely this video is for the general public, but there are two main set of people that I am targeting, and I hope everybody gets to benefit from this video. So number one, in no particular order, okay, number one are mothers. Okay, I'm going to tell you why I'm saying I want to talk to mothers today. Like, aside from not just mothers, parents. I'm going to say parents because it takes two to give birth to a child, right? But particularly mothers, because they are always the closest to children, and they are the ones that are maybe are more observant of the two parents. All right, so anyway, like I said, in no particular order, well, number one, parents, particularly mothers, and number two, people who have similar symptoms that I will mentioning today, but have not been able to put all the symptoms together to realize that they have PCOS. Yes, I'm talking to you. So let's dive right into it. Yes, we are talking PCOS today, and yes, I am definitely going to be telling you how it is, how it has affected my life, my experiences from A to Z. I'm not going to dilute anything. I'm going to say to you raw the way it is happening in my life, so that you get to learn from it. Okay, there is no point hoarding or hiding any part of it, because at the end of the day, my aim is to make a lot of people learn or understand the situation called PCOS, so that they can take quick action if they feel similar symptoms. All right, so let's talk about PCOS now. What is PCOS? Okay, what is PCOS? It simply means polycystic ovarian syndrome. Okay, polycystic ovarian syndrome. Okay, poly means many, cystic means cyst. That means many cysts, right? So where does the many cysts occur? Now, PCOS occurs in the life of a woman in a situation where a woman's ovaries, women have two ovaries, one on the right and one on the left. So a situation whereby a woman's ovary produces an abnormal level of androgens is what causes PCOS. So what are androgens? Androgens are male hormones. Yes, you heard me right. Male hormones. Now, there are two main types of androgens, but the one that bothers women that have PCOS the most is testosterone. Okay, now testosterone is a male hormone. Like I said before, testosterone is an androgen. Okay, so when you say androgens, it means testosterone and one other androgen, because there are two main types. Okay, now testosterone is an hormone, predominantly a male hormone, but every woman on earth has a level of testosterone in them. Yes, women have their own hormones, two types, estrogen and progesterone. Okay, now aside from the female hormones that we have, estrogen and progesterone, we also have testosterone, a tiny bit of testosterone in us, which is a male hormone. Even though it's a male hormone, we have a tiny bit of it in us all. This helps us during reproduction, giving birth, getting pregnant. That's the work of that tiny bit of testosterone that we have in us. Now, when it becomes a problem, the time it becomes a PCOS issue is when we have a little bit more than usual. When a woman has a little bit more than they should have, all right, that is when PCOS occurs. It is a pure case of hormonal disorder, hormonal imbalance. So when you say your hormones are imbalanced, it simply means your ovaries are producing an abnormal level of testosterone, or you can say androgens. Okay, that is when PCOS occurs. So now let's talk about the symptoms that I have experienced so far. Number one, body hair, like I have hair, these are symptoms of PCOS. If you have facial hair, if you have hair all over your body as a woman, these are signs of PCOS. Okay, I'm a very hairy person, like I have hairs all over my arms, my legs, and every other thing, and whatever. So these are signs of PCOS. Okay, even though the hairs in my body make me look very cute, but at the end of the day, it's a symptom of PCOS, which I never knew until now. Okay, so number 2, hair loss. My hair pulls out. If you have PCOS, they call it thinning of hair. Your hair, you begin to lose your hair. My hair was this long. I'm going to put some pictures, all right, so that you can see how long my hair was, and my hair kept pulling off until it got to this level. Okay, it's very thin. My hair used to be very full, but now it's very light. Okay, these are signs of PCOS. Okay, so if you're losing your hair, you have hair, facial hair, or you have hair all over your body, it's a symptom of PCOS. So now, lack of, if you don't menstruate, women with PCOS, some of them do not menstruate at all. They do not see their periods. Okay, like I said before, I'm going to be telling you the way it is. I'm not going to be covering up anything, so that you can properly know what the situation is all about. Now, no menstruation at all. Some women do not have menstruation at all, and definitely if you don't menstruate, you cannot ovulate, right? Now, in my case, luckily, I have been menstruating from the beginning of my life. I do menstruate, but the only thing is that my date shifts a lot. A lot of people have same date all the time, like next month, same date, the other month, same date. But in my case, because of my hormonal disorder or hormonal imbalance situation, my dates tend to change anyhow, any day, anytime. So I cannot particularly say, oh, my period is coming so date, because it can come anytime, and it changes date like that. So that is one that's a sign that my hormones are not balanced. So now let's talk about no menstruation at all. Some women do not menstruate at all when they have PCOS. Okay, in my case, like I said, I have my periods, but the dates change anyhow. It's not expected a particular date in every month. Now, in my case, when it comes to and a symptom of PCOS, you don't have menstruation, and you also sometimes you don't ovulate. All right. In fact, most of the time, a woman with PCOS do not ovulate. There is no ovulation. Some don't even have menstruation at all, or some might have their menstruation and don't ovulate. Do you understand? Some don't have menstruation at all. Some do have menstruation, luckily, but do not ovulate. Some don't even menstruate at all, and some don't have ovulation at all. So in my case, the way it's happening to me, I am menstruating, dates change anyhow, but when it comes to ovulation, it's in and out. It comes, it comes, like I see it, I don't see it. I see it, I don't see it. In some women, I still feel fortunate, because a lot of women suffering from PCOS do not even see their menstruation at all. They do not see their periods, not to talk of ovulating. Some have never seen their periods since they were born. Yeah. So now if you are in the situation, I'm going to be discussing with you the things your doctor might likely talk to you about, what to expect from your doctor when you go there, because the truth is, not all doctors know anything about this condition. My doctors were not able to help me in any way, but I'm going to get to that. All right, so I have talked about lack of menstruation, but in my case, I do have menstruation. Now, loss of appetite, yes. Because of your hormonal disorder, you are likely not to be able to eat properly. I have never been able to eat properly. I struggle to eat. Now, lack of sleep. I don't sleep properly at all. Like right from time, I've always struggled to sleep. Now, what again? Now, so let me see, because I do not want to forget anything. So now, the major one, acne. I almost forgot that. Thank God I wrote it down. Acne. Oh my God. Forget the fact that you're seeing my face now. Seriously, I had acne from the age of, I think, 15. Yes, I started having acne from the age of 15 up until 2018. Okay, I got so frustrated. So acne is one of the symptoms, okay, as a major, because when there is testosterone, higher testosterone level in you, you have PCOS, and then it begins to trigger acne, it begins to trigger hair all over you, it begins to trigger loss of appetite, lack of sleep, it begins to trigger no menstruation or no ovulation at all. So in my case, acne bothered me from the age of 15 up until 2018. Look at how grown I am now. Up until 2018, I was fed up. I had acne all over my head, my forehead, my cheek, my chin, everywhere. It was disastrous. My skin was in trouble. Another problem of PCOS, another symptom of PCOS is skin issues, extreme dry skin. Okay, everything will go wrong with your skin. You will just not enjoy your skin. Your skin is easily attacked by any type of skin issues. Okay, so I struggle with extreme dry skin. All right, so for my face, extreme acne. So but by 2018, I got fed up. I tried everything. Nothing was working for my acne. Then I stumbled upon on YouTube I stumbled upon Accutane. So Accutane has been the only medicine I have used rigorously on me that has helped clear my acne. So, but even at that, it can come back anytime. I took it in 2018. I enjoyed my life until 2019. 2020, it all came back again. I had to go back on Accutane. That shows you that my hormonal imbalance is still there. So acne is one of it. So infertility is one of it, because the truth is that if you don't menstruate, you can ovulate, and if you don't ovulate, you can get pregnant. So that is the thing. So infertility in some women, not all women, a lot of women that have PCOS give birth. Don't get it wrong, they give birth. Okay, so but unfortunately for some people, it affects them to a point where they are not able to have children. Now another symptom of PCOS is weight gain. Okay, they add weight so much, they get so big. Listen, in my case, it's not a symptom for me because I have never been fat, not even one day. So there was a time I went to my doctor, and my doctor, when the first time I was diagnosed, I was told officially that you have PCOS. Okay, doctor was like, well, how come you're not fat? I'm like, must I be fat to show that I have PCOS? Not all of the symptoms we all must have. Yeah, so weight gain has never been one of my symptoms. So let me see, so that I don't forget. Yes, I've mentioned acne, facial and body hair, loss of appetite, loss of hair. My hair pulls off like that. Dry skin. Okay, abdominal pain. I feel extreme pain in my lower abdomen, and I've been to so many doctors. I've carried out so many tests. They've not been able to tell me why I feel pain, but I strongly suspect that it is the follicles and the cyst in my ovaries that is hurting me. Okay, so now let's talk about acne again. Now one of my ovaries has more follicles or more cysts than the other one. Now PCOS, when you look at your ovaries as a woman, we have two. When you're being scanned, you see that there is a dot-like ring kind of thing on your ovaries. Each of your ovaries will have, sometimes some women have only PCOS on one ovary, some have on the both. But in my case, I have more of it on the right ovary. I didn't used to have on the left ovary, but these days it's beginning to come up on the left ovary as well. So on the right ovary, I have a lot of follicles. Okay, we can call it cyst as well. So it goes round when you're being checked. It's like a ring, like a bangle, like a bracelet. You know the way bracelets are. So dot 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 all around. That is signs of PCOS. Okay, so so I never knew, because I used to wonder when I was growing up. I used to have more acne on this cheek, a lot, like that is where the whole thing wants to die. Like my cheek, this right cheek used to have a lot of acne, and I used to wonder how come. I used to have on my forehead, my chin, my forehead, chin, but here I didn't really used to have much at all. It's always faint. But too much on my forehead, you would think I have a disease, like an unexplainable disease. It was always too much. So like I was saying, I used to have a lot of it over here. Okay, so and I used to wonder why so much acne on this side. And I got to realize, now that I'm grown and now that I've been going for regular tests and checkup, I realized that my right ovary has more cysts, PCOS issues, the follicles on it than the left one, and that's the reason why I had more acne on this cheek than this cheek. Okay, so So now, as I was saying, women with PCOS have insulin resistance problem. Okay, I'm going to be explaining to you what insulin resistance means. Insulin resistance simply means when your cells isn't working with your body to break down the blood sugar or the glucose in your body into energy. Okay, so once all the sugar you consume, all the sugar you take in, carbohydrates, you know, at the end of the day, everything is broken down into sugar into your body. When you eat rice, you eat bread, all this carbohydrate related food, they all come into your body, you know, resulting into sugar. So your body produces more insulin, and then your cells are not able to work together with your body to break down all this sugar, all this blood sugar, all this glucose in your body, to break it down into energy. So that means the sugar stores up in you, and that is why a lot of women get eventually fat. You feel me? So when you get fat, there is a problem, because it's a sign of PCOS. Your sugar is right there in you and it's not going anywhere. That is why it is important. You see people tell you don't eat sweeties, don't eat junk food. These are one of the reasons people advise not to eat junk food and sweet things and too much carbohydrates, eat veggies and all of that. So now women who add weight like that tend not to ovulate. Okay, so when you add a lot of weight gain is one of the major problem of you not having ovulation. And so when you see a lot of fat women not giving birth, it just simply means they need to lose weight so that the ovulation can come forth. You know, weight gain causes ovulation not to come. I want you to know this today. If you're fat and you're having infertility issues, go lose weight and watch what you eat. It is simply a sign of hormonal disorder, and you need to stop eating carbohydrates, you need to stop eating sweeties, chocolates, junk, so that you are able to process normally and so you're able to give birth. So these are some of the symptoms. Okay, I do not want to forget anything. So like I said, in my case, I don't have weight gain. I've never added weight, but I had a lot of acne. Like I told you, it can come anytime. Okay, so I've only been able to control it with Accutane. I made a video about that. I might put the link down below so you watch how I cured my acne with Accutane. Okay, so now let's come down to why I said mothers and people who have similar symptoms. So if you have all the symptoms here and there and you're not able to put them together, I just explained to you. If you feel the similar symptoms, please kindly go see your gynecologist so she can properly diagnose you and begin proper treatment on you. I must warn you that doctors sometimes do not help. They do not know. I don't know, maybe in this part of the world, Dubai, you just go there and at the end of the day you come out a failure, because at the end of the day they tell you nothing relevant to help you. All the answers I got regarding PCOS, God bless YouTubers, God bless every single person that puts information out there on Google or on any website to help other people. I respect you people, YouTubers. Thank you so much for everything you do to put out information out there that helps a lot of people. Every single thing I know today about PCOS has been because of YouTubers. Thank you so much. Fellow women like me that have similar problems, they come on YouTube to talk about this problem, and that was how I gained knowledge of this. So whenever knowledge of this PCOS of a thing, I had no idea. And whenever I went to see a doctor, they don't even tell me it's a problem. So I remember when I had my fibroid surgery in 2019, all my reports stated polycystic ovaries, polycystic ovary. It is screaming and shouting polycystic ovaries in all of my reports. But guess what? Not one doctor, the doctor that handled my case, my fibroid surgery case, never one day mentioned to me that my ovaries are polycystic and it's a problem. Never. And for every other doctors I visited subsequently, none of them ever told me it's a serious problem, let us place you on hormone pills or hormone medicines or whatever. None of them. It took a lot of YouTube watching other women who struggle with the situation to make me realize these are the type of things that my doctors should have told me. So whenever I go to see my doctors now, I am the one telling them what to do to me. Do you understand? So the struggle has been for real. It is not a joke. Now let's talk about mothers now. So it is not a joke. I remember when I went to see my doctor, this doctor I'm seeing now, and I said to her, "Oh, I already know I have PCOS." I was expecting her to tell me why I'm feeling pain in my abdomen, and then when the result came out again, everything still stated polycystic ovaries, blah blah blah, and I was looking at her to tell me more. And as usual, they will not tell you. PCOS is a problem. You need to deal with it. We need to place you on hormone pills. Nothing. She was looking at me, and then I said to her, are you not going to place me on birth control pills to balance my hormones? Oh, she was like, yeah. I should place you on hormone pills. I'm like, wow. And I also said to her, and I changed my diet. Oh, yeah, you should change your diet. So the thing is, if you don't say things to them, they don't just know what to tell you. So it's been a struggle. So thank you so much again, YouTubers, for helping me, because you are my doctors. Anyway, so in order to avoid, we have insulin resistance problem. And if you have insulin resistance problem, it means you cannot eat sugar at all. Do you understand me? Anything that will produce sugar in your body, avoid it. And people like us with PCOS, we tend to have the possibility of having type 2 diabetes. Why? Because our sugar level isn't breaking down into energy. It stores up in us because of our hormonal imbalance, because our ovaries produce testosterone more than usual. Do you understand me? Do you feel me, guys? Okay, that is the reason. So women with PCOS, stop eating sugar. Stop eating carbohydrates that produce sugar in your body. Stop eating dairies, any dairy product like milk, like cheese, like any other thing that you know that is from dairy. Stop eating them, because at the end of the day, dairy products have their own type of sugar called lactose. Do you feel me? So when you hear people say don't take milk, yes, don't take cheese, or don't take any other dairy product, that is because dairy products also have their own type of sugar. Now let's come to carbohydrates. You know everything that brings about carbohydrate: bread, rice, anything carbohydrate food related. Avoid it as a woman that has PCOS. Do you understand? Remember I said if you add weight, if you're fat, your chances of ovulating are very slim. So you need to avoid being fat. If you're fat, you need to start exercising. If you're infertile, you're not able to have kids, you need to exercise to reduce your weight. Do you understand me? You need to exercise to reduce your weight so that your ovulation can come. Too much fat in you causes your ovulation to stop. So now, like I said before, I don't know if I mentioned this before, for me, my lack of period is one of the symptoms. I think I mentioned it before. Now, your period, in my case, I said it, I don't know if I've said it before, I can't remember now. Now, in my case, my period comes, but the date changes. Okay, it comes, but the date changes every now and then, every month. That is sign of hormonal imbalance. But in some women, they don't have their periods at all, and they don't ovulate at all. For me, I menstruate, date changes every now and then. I don't know when it's gonna come every month, but then my ovulation comes today, it comes tomorrow, it doesn't come next tomorrow, like that. That is my own situation. I told you I'm gonna be telling it to you raw as it is. There's no point covering up anything. For me, I feel kind of fortunate because at least I still see my menstruation, my period. There has never been a time I've never seen my period. My period has never ceased. Some people, right from birth, or right from the age when they're supposed to be seeing their period, they've never seen their period up until now. So now let's talk about things that can help you, that can trigger your menstruation. Okay, so now if you do not have menstruations at all, going on birth control pills helps. Yeah, I've started taking more. Now, in my case, I told you I do see my period, all right? But birth control pills helps, I don't know if this is seen properly. Birth control pills helps to balance your hormones. It helps to reduce the level of testosterone that come in addition. Like, you're supposed to have a normal level of testosterone in you, but that little tiny one that makes it more, the birth control pills helps you regulate it. Now, your testosterone shouldn't be more than your estrogen and progesterone. These are two female hormones. Testosterone should not be in any way higher than them. That is when you begin to have severe hormonal imbalance disorder, and that is when you begin to have problems like PCOS. Okay, there are many more symptoms, but these are the symptoms that I feel so far, and these are the things I'm discussing with you. Okay, so now please consult your doctor. You need to speak to your doctor. I practically had to tell my doctor before she remembered, yes, I'm supposed to put you on birth control to regulate your hormones, to reduce the testosterone in you, so that your androgen and progesterone gets to work, process properly. And now this actually helps when your testosterone levels is reduced. Okay, it means that the hair, facial body hair, and everything that you experience, they gradually fade away. Okay, it means that your lack of period that you don't have gets to come back. It means that your ovulation that you do not see gets to come back when you are on birth control pills. It helps you regulate your hormones, and as a result of that you have a more balanced hormones, and then you can function properly. Your insulin resistance problem gets to reduce, okay, and your sugar level gets to go normally when your hormones are balanced. So remember that I said that when your hormones are not balanced are when your testosterone, a male hormone in you, is comes up in you more than usual. So birth control is one of the most helpful pill that helps women with PCOS. I'm already on it. Thank God I reminded my doctor. So if you want to give birth, all right, for now, there are two things that can also help. Now, metformin. I'm not sure if that is showing properly. Metformin, also known as glucophage, okay, is one of the very powerful medicines that help women with PCOS. This is a drug used by people with type 2 diabetes, okay. Remember that I said that women with PCOS have insulin resistance problem, which means that sugar tends to store up in our body, and we all know that the cause of diabetes is sugar, okay. So glucophage is used by type 2 diabetes patients, people who have diabetes. So as a result, women with PCOS, since we have sugar related issues, insulin resistance problem, we are usually prescribed glucophage or metformin. It's called glucophage or metformin. So this actually helps to regulate your hormones as well, okay, and it helps to trigger your ovulation. It purely helps to bring back your ovulation. So now what I do now, and another thing that helps to trigger your ovulation is inositol. All right, I'm not sure. Inositol is amazing. It helps regulate your hormones and helps to trigger your ovulation. It helps to remember that without ovulation a woman cannot get pregnant. That is why some do have infertility issues as one of the symptoms of PCOS. Okay, this is a long video, but at the end of the day we need to do what we need to do. So now, for example, at the moment, if you want to give birth, you're ready to give birth, you're ready to have children, this is highly recommended, okay. You can consult your doctor to prescribe these medicines for you. If they don't know what to do, you can simply tell them, things because this is what I do. I practically tell them all the knowledge. They don't know anything. I was frustrated all my life. I made researches. I did everything all by myself. So when I go prepared. So I go to tell them what they should do to me. Imagine that. And you've paid for all these things, but yet nothing. They're not delivering anything. So because of the incompetency, I have been the ones doing my own doctoring by myself. And thanks to amazing YouTubers that put out information out there, that has helped so far. So because I was able to tell my doctor, they've been able to place me on the right diagnosis. For a long time, I suffered, not knowing that I suffered, not knowing that what was supposed to help me. So if you're ready to give birth, metformin is also called glucophage. It will help you regulate your hormones and trigger ovulation. Ovulation helps to get pregnant. Inositol is another one that's going to help you. So, but if you're not ready to give birth, birth control, okay, is what will help you regulate, and birth control is what will help you regulate your hormones, and will trigger menstruation to come and then ovulation to come as well. Definitely, if you're on birth control, it's not possible to get pregnant. You feel me, right? All right, so if you're ready to give birth, here we go. If you're not ready to give birth, birth control, okay? So I also take some other things just to keep me healthy. I take some other multivitamins. I also take iron, all right? Because we tend to look anemic because of this, all right? Our iron level goes really bad. So I take iron, I take vitamin D, some of them are not here, just to help me with my general health. Okay, so now I'm going to relate the situation to what I said, mothers. In the case of mothers, I'm going to be rounding up very soon. I hope this will help a lot of people. So in the case of mothers, so in my situation, I looking back now, all that I know, looking back, I have had my symptoms like right from when I was young. For example, lack of sleep. I have never been able to sleep right from when I was a child, like when I was young. From the age of, I think 13, 14, I've never been able to sleep. I struggle to sleep. Now, food, never have I ever been able to eat. I practically take pills to be able to sleep or to eat. Now, And this has happened all through my life. So why I said mothers or parents is because in my case, if somebody have taken out time to listen to my symptoms, to look at my symptoms and know that this girl is not okay. Now, I had severe acne way back since I was young. From the age of 15, I started having severe acne. Nobody ever asked me, why are you bringing why is acne out on your face? Let's go see a dermatologist. Nobody ever asked me, why don't you sleep? Nobody ever looked into my case. Why don't you eat? Nobody ever looked into my case. Why do you have menstrual pain? I used to have extreme menstrual pain as well, once in a while when I was younger. So because of all of these things, if, for example, somebody has taken out time, any of my parents, to see that this girl isn't sleeping properly, and it happened all through my life up until this age, even till now, I still struggle to sleep. I still struggle to eat till today. So that means I have had my PCOS even right while I was younger. So if somebody had actually paid attention to what is wrong with their child, like, oh, she cannot sleep, let's take her to the doctor. She cannot eat, let's take her to the doctor. Oh, there's so much acne on her face, let's take her to the doctor. Oh, she has severe menstrual pain, let's take her to the doctor. They would have been able to the doctors would have somehow been able to put 2 and 2 together to realize that I have PCOS. And from that young age, my diet would have been managed. Because as it is right now, as grown as I am, I've been deeply affected. All the years of me eating rubbish. Like, not really rubbish, I don't eat junk. But the truth is, I would have avoided the situation if proper care was taken when I was younger by my parents. This is the fact. Okay, they would have managed my feeding, managed what I eat, made sure that carbohydrates was left out of my food, made sure that I don't eat sweet things, although I'm not the person that eats sweeties anyway. I don't like sugary things. But unfortunately, Africans eat a lot of carbohydrates. We eat a lot of carbohydrates. We hardly eat fruits. We hardly eat vegetables. Okay, so all these things would have been avoided while I was younger. I wouldn't have suffered in my older age because I am suffering. When I tell you I have severe pain, it is severe. Like, I am struggling with everything. But I thank God for the strength that I have, and I thank God for all the researches so far. So please, parents, right from time, pay attention to the problems in your children's lives. This is my message for you. Don't act like you know too much. Don't look away. There are many things in the lives of a child that you need to care about. And if there are things that you cannot see with your eyes, make sure you create a very friendly environment for your child where a child can tell you things that are happening in their lives. Okay? It is very important. It has affected me so badly. Because I remember then when it becomes so worse, 2-3 days I won't be able to sleep. I will get so fed up. I won't be able to sleep. I won't be able to eat. I will go by myself as a young child, go to the pharmacy. We call it chemist in Nigeria. I will go there and I will go buy super appetite. People from Nigeria know these medicines. Or Ciprigold. These 2 medicines trigger you to sleep and also to make you hungry. And when I take it the first day, it makes me sleep for a long time. The second day, it's faded away again. Then I have to deal with my reality all over again. So, and as a child, I don't think I should be the one doing that. Going to the chemist by myself, self-medicating, all because nobody was paying attention to my symptoms. Nobody cared to know what was happening. So it was pretty much a difficult time for me. There is no excuse for parental negligence. Do the right thing for your child. Make sure you're into your child's life. Make sure you know everything that takes place. Every body changes that occurs in the life of a child is very vital that you parents get to know about it. Okay, it doesn't matter if it's a girl, a boy. Please look into your child's life. At every stage of their lives, every stages of their life, it is important that you are there for them. Okay, anyway, thank you so much for watching. Please subscribe to my channel. I would really appreciate it. And when you subscribe, remember to drop a comment so that I'll get to thank you personally for being a part of my family. Thank you so much for watching. Have an amazing day, guys. Bye bye.